Right. Hello, everyone.
Hi, everybody.
Welcome back to the Push Podcast. My name's Sydney. I am a labor and delivery nurse and online birth educator.
I'm Megan. I'm an OBGYN and clinical researcher.
And today we are talking about Hyperemesis Gravidarum, or HG for short. So this is a very popular, highly requested video for me, at least on my accounts. A lot of people have requested for me to talk more about HG. And if you're like, I have no idea what that means at all, don't worry. We're going to talk about it. We are going to dive right into exactly what it means, but it's basically a condition that is a very severe form of morning sickness. So that's like a very brief overview if you're wondering if you should continue listening to this episode or not. But we are going to be talking all about it. We are going to go over what the actual definition of it is, how you get diagnosed with it, signs, symptoms, how to manage it.
We have partnered with HG Canada to produce this episode today.
Yeah.
And so we're very, very lucky to be shortly welcoming a couple of guest speakers onto the Push Podcast.
Yes, we're so excited.
We feel very comfortable and really emboldened to talk about Hyperemesis Gravidarum and make sure that we're conveying the appropriate clinical information about how it's diagnosed, what it means, and how we can treat it.
Yes.
But the truth is that with this disorder specifically, and I think with lots of similar disorders, no amount of explanation on our part as clinicians is really going to get across the impact
of what it is,
of what this feels like to go through it.
Yes.
And so we have Julia and Maria on with us today.
Yes.
We'll introduce them shortly here.
Yeah.
Who are the co-founders of HG Canada.
Yes.
And have both suffered from HG in their own pregnancies as well. And so we're very, very happy and very, very fortunate to have them on here as well today to offer that real world.
Yeah. To shine a light on what it's like to have the lived experience of hyperemesis, because it is a condition that is very difficult to deal with. And I'm sure they're going to talk more about their experience. But so we're so excited to have them on. Thank you. Thank you so much.
And if you guys have been nauseous in your pregnancy, if you've ever wondered, why did nobody tell me that first trimester was like this? If you've been struggling to take sips of water and hearing people tell you just eat saltines or take ginger or any of these things as you're just trying not to throw up 20 times a day.
Literally.
This episode is for you.
Yeah.
Okay. And without further ado, let's get into it.
Yes.
Perfect. So listen, a lot of people ask me, and I think I hear a lot, kind of what is the difference between Hyperemesis Gravidarum and more garden variety nausea and vomiting of pregnancy, right?
Yeah. Yeah.
Because nausea and vomiting, especially in the early days of pregnancy, is super, super common. Up to 90% of pregnancies experience some degree of nausea and vomiting.
Exactly.
However, only about 3% reach levels that are consistent with Hyperemesis Gravidarum. So again, typical nausea and vomiting starts around week 5, week 6 of pregnancy, usually peaks by week 9 or 10. And most people can still function with this. Yeah. Okay. You feel awful. Yeah. Right. For many people. But your vital signs are stable. So that means your blood pressure isn't dropping. Your heart rate isn't rising because of dehydration. Your weight is stable or increasing appropriately. Yep. And if we were to do blood work on you or urine tests on you, those values would remain normal. Yeah. So that means you can still hydrate. You can still eat something, right? And you're not ending up in our ER because you're feeling so unwell that you're not able to take care of yourself, right?
Yeah. It's not impacting your activities of daily living.
Exactly.
To an extent where you are literally unable to function because you are so dehydrated.
Exactly. So Hyperemesis Gravidarum represents that severe end of the nausea and vomiting of pregnancy spectrum, right? So this means persistent vomiting. Some definitions suggest that weight loss of more than 5% of your pre-pregnancy weight is consistent with HG. You're dehydrated. You have ketones in your urine, which we'll talk about a little later. You have electrolyte abnormalities because of this, broad dehydration. Yeah. And you really just can't even keep fluid or foods down. Daily life is impossible with HG, right? It's not just nausea. It's like a full body system problem.
Yeah.
Okay. And And I think we'll leave that definition there for a moment, I suppose. But I also want to just capture, before we get too much into the depths of hyperemesis gravidarum, obviously that is like a very severe form of nausea and vomiting of pregnancy, and requires like a really mindful, really specific, I think, approach to management. Requires a lot of like getting ahead of the nausea before it becomes too severe. But I also just want to say as well, I don't want any of our discussion today to invalidate the experience of people who are going through nausea and vomiting of pregnancy that doesn't quite meet the criteria of HG.
Yes.
Right?
Yes. I was just going to say, like, this isn't to discount if you're having extreme nausea and you're not necessarily vomiting, or if you're vomiting, once a day and it doesn't meet that criteria for HG, but it's still really hard. And there are still things that we can do as like your providers to help with those symptoms too. So it's important to still bring up to your provider if you're having symptoms that are impacting you and still quite severe enough that we need to even run through the criteria if this meets HG or not. Bring that up to them. There are things we can do. There's medications we can give you to hopefully help to mitigate these symptoms, at least for that first trimester when you're experiencing them.
And nausea and vomiting of pregnancy that falls underneath the threshold for HG still can be treated, right? Like you do not have to suffer.
No.
Through nausea and vomiting.
Don't suffer just because, this is the norm of being pregnant. Like you always hear, if you're pregnant, you're going to be puking. And it's like, yes and no, right? Like there's a line. And you might, if you're only experiencing it a couple times during your pregnancy and you can handle that, then that's fine. But there are things we can do if this is something you're dealing with daily.
Yeah, absolutely. And it's not your job to self-diagnose.
No.
Right?
No.
I say that not to, again, like discourage people from like empowering themselves with knowledge about these conditions, but I don't want you to sit at home feeling like you are in charge of that, right? Like come in, see your provider, explain what you're feeling. That burden of responsibility shouldn't be like on your shoulders, right?
You're not overreacting.
No.
I feel like a lot of women specifically, but also a lot of moms who have children too already, they tend to, put their own care and their own health to the side.
Yeah.
And you're not overreacting if, you are dealing with nausea and vomiting in pregnancy. It is hard.
Yeah.
Like in any other case scenario, if this was anyone else, we would be investigating it, right?
Yeah.
So keep that in mind.
Yeah, absolutely. So listen, without further ado, let's welcome Julia and Maria onto the podcast so you can hear a little bit more about what this lived experience actually is like for people.
Yeah.
And then we're going to break down a little bit more some of the pathophysiology behind hyperemesis gravidarum, some of the management strategies, and red flags for treatment.
Absolutely. All right. Hello, everyone. We are joined here today with Maria and Julia from Hyperemesis Gravidarum, Canada. We are so excited to have you guys on the Push podcast. Would you, Julia, maybe you can start, maybe you can introduce yourself and tell everyone just a little bit about yourself before we get into the episode today.
Sure. So I have experienced hyperemesis 2 times. I am an educator and I am a mother, and I have become a very passionate advocate for those going through and experiencing HG. Back in 2024, Maria and I met through a Facebook group that I had created for Canadians who had gone through HG. And we really connected and decided that we wanted to do more. And so we came together and created Hyperemesis Gravidarum Canada. And we are an advocacy team. We've worked on a few initiatives together. And I would also like to thank you so much for having us on the podcast today. I'm so excited that you're highlighting HG, and Maria and I are so honored to be here. I can't wait to get into it a little bit more.
We're so happy to have you. Maria, why don't you introduce yourself as well? We'd love to know more about your side as well.
Of course. So thank you for having us. Actually, when Julia told me about this opportunity, I was very excited because I am a fan of your podcast. I think that what you do is fantastic. So I'm really honored to be here. My name is Maria. I am a psychologist by training. I am an immigrant. So that added a layer to my experience. I work as a researcher on maternal health, and I landed there because of Hyperemesis gravidarum. I experienced a very severe pregnancy, well, a couple of severe pregnancies, and that motivated me to do more for other moms.
Amazing. Well, thank you both for everything that you do. And I am just so grateful that you're both here today, because I think the lived experience combined with the drive and motivation for advocacy just brings such an incredible perspective on this, like, challenging to say the least, condition of pregnancy. And so we would love to hear a little bit more from both of you on what that experience was in your pregnancies. Can you kind of walk us through some of the early days as you began to realize that something was not right?
Sure. So when I had my first pregnancy, it coincided with the pandemic. So that also adds another layer to my experience. But during that time, I assumed I had morning sickness, just regular morning sickness, pregnancy sickness. And I was told, it should get better by 12 weeks. But at 12 weeks, I was still vomiting an excessive amount of times a day. And I started questioning, what is this? I was told it was supposed to be better by now. But because of COVID and the way that things looked during that time, I was not diagnosed with hyperemesis gravidarum. I just assumed I had the worst possible pregnancy sickness that you could have. I tried to do some research, but at the time there wasn't much that I could find online about it. So I just took it as it came and tried to do the best I could. I was working from home at the time because it was the pandemic, so that did help. But my husband and I both questioned really why I was so severely ill. It seemed extreme. And then when we decided we would have a second child, I thought, there's no possible way that I could be as sick as I was the first time. That's the worst of it. So my husband and I kind of tried to plan it so that it would be, a convenient time to maybe have a second child. And if I were sick again like that, then we kind of had a few thoughts on how that would work. Unfortunately, I had more extreme HG the second time round. So it was even worse. And it was even harder because I had my firstborn to care for, who is still a young toddler at the time. So it was a very challenging experience for myself, for my family. It was very hard to understand. It was very hard to know how to how to navigate the medical system. I wasn't sure what I should be doing, where I should be going. I tried to do some research, but when I tried to look up basically what I was going through, I had a hard time because screens were a trigger for me, and they immediately made me sick if I looked at them, especially the first few months. So I tried to do my research, but it's really very difficult when you're in such a debilitating state and you're so unwell. You don't really have the capacity to do that. So after both of my pregnancies, and I was diagnosed a second time with hyperemesis gravidarum, after my pregnancies, I discovered the HER Foundation based in the States. They also support internationally. And it was like, oh my gosh, look at all of these resources, look at all of this information. What was I missing? How did I miss all of this? So that was a huge moment for me. And then I kind of really delved into what HG was and how come I didn't access any resources or wasn't provided with resources or information on what I was going through. I was bedbound for quite a bit of time. My husband was caring for our firstborn. I had to take time off work. It was very debilitating, 24/7 nausea, very, very hard, very isolating too, because you don't want to be socializing. I was bedbound, and it was really hard to even, impossible even, to reach out to other people and let them know how sick I was, because it was hard to explain as well when I was in it. So that was very challenging. And after going through that, I decided, you know what? something has to change. And
Yeah.
so this is how I kind of ended up here today with you both and Maria.
Amazing. And how did you
Wow.
find like navigating some of those early conversations, trying to explain to your providers or your support system, like why this was so bad?
It was very difficult to explain how bad it was. I think I wasn't sure how to approach it. I was describing, how much vomiting I was having, that I was unable to drink water, that I was unable to keep liquids down. But even explaining that when you're in such a debilitating state, oftentimes I would go to the appointments and just be thinking constantly in my head, don't be sick, don't be sick, don't be sick, when I was sitting there in the chair waiting for a practitioner to come in. So definitely putting my symptoms into words was a huge struggle for me. And I think if I had had some advice on that and if I had written it down or I think there are things that can be done so that it is more clear. But at the time, it was very, very hard for me to describe and explain everything I was going through, especially some of the more strange symptoms like thyroidism, which was excess saliva, and all of these sensory sensitivities. So emotion, light, sound would immediately trigger me to be sick. So they were very odd and hard to put into words at the time.
My gosh, just wild. I in my own pregnancy, I had excuse me, quite severe nausea and vomiting, falling far short of hyperemesis and what you experienced, Julia. But I remember texting my colleagues and my friends at the time saying, why did no one tell me it was so bad? Like, why did nobody tell me that this was the cost of feeling this way every day? And I
Yeah.
realized that in fact we do talk, like people do tell you that it's that bad and we're dismissive of the symptoms as normal, as part and parcel of
Being
pregnancy,
pregnant.
which makes
Mhm.
it far harder, I think, to really impress upon people what you're experiencing, especially in these really severe cases. Maria, I wonder if you can chime in as well from your perspective, especially coming from a psychology background. This must have been such a strange experience to navigate.
Yeah, it was very extreme for me. I was fairly new in the country. I got pregnant after 3 months of being in Canada. So I was not only navigating the pregnancy itself, I was navigating a new system for me.
Hmm.
So it was very shocking because I was expecting a wonderful pregnancy, all the baby showers, baby reveals, photo shoots, all the amazing stuff that you see around. And what I got was months hospitalized, lots of hours in the emergency room until I finally landed in a home care program.
Hmm.
But to reach that point, I needed to struggle quite a bit and really self-advocate to get the treatment that I really need. So I started vomiting, I think that almost as soon as I got pregnant.
Mm.
And that's how I found out that I was expecting a baby.
Hmm.
Everyone around was telling me it's just morning sickness, like that is normal. Then my husband was telling me, like, no, you are not okay. Like, we need to go to the hospital. This is not normal. We tried all the oral antiemetics, all the possible combinations, but really the only answer was IV medication.
Hmm.
And even through the whole pregnancy, even having IVs almost daily, I never stopped vomiting. So it was exhausting for me to go every couple of days to the emergency with the same story of I have vomited more than 30 times, more than 40 times, and then face that situation where someone looks at you and tell you, that's not possible, you are exaggerating. But fortunately, I found also very good and supportive nurses and doctors that helped me in that advocacy to get the right treatment. So I kind of found both. I found very dismissive healthcare providers who told me that I was probably crazy, everything was on my mind, I was exaggerating, I was just needing attention, and found very good ones that really were by my side and took it personally and advocated for the right treatment for me.
Wow. Well, thank you for sharing your experience. It sounds so difficult to be like from a psychological standpoint as well, like you're explaining how you had to advocate so much for yourself, which I think that's also why it's important that we have these conversations today so that hopefully, what you guys are doing too just drives change, right? So that other women hopefully don't need to have the same dismissive experience that you both experienced, right? So, yeah, we really appreciate you guys sharing that.
Yeah. Maria, I wonder from the maternal mental health perspective, how do you think that this emotional toll impacts women and pregnant people going through this?
Well, it not only affects during pregnancy, it stays
Mm-hmm.
with you. It's a trauma that stays with you actually forever. You help other people, you try to cope after the fact, but the trauma is there. I myself needed therapy during my postpartum because I was experiencing post-traumatic stress disorder. And not only me, even my kids. So during my first pregnancy, I didn't have as much support, but during my postpartum, I realized that I needed something for my mental health, that it was just not moving forward, and that was it. So I got the right support, and that prepared me for my second pregnancy. But after my second kid was born, it was not only me. Actually, my daughter was also experiencing post-traumatic stress disorder. Even nowadays, if I am nauseated or I vomit because I don't know, I got a virus, she gets very anxious and very nervous about me getting sick and then needing to go to the hospital and staying there for a long period of time. So it was very complicated. And in my second pregnancy, it was post-COVID, but we still had COVID measures. So I was hospitalized for almost a month in a COVID unit, totally isolated from my husband and my kid.
Oh my goodness.
And I think that experience really made me realize the extreme impact on mental health because I was isolated, I was getting depressed, trying myself to cope with the situation with no support because technically I was getting everything that I needed. Yes, I was getting the IVs, I was getting the antiemetics, I was getting vitamins replacement, minerals replacement. I was getting everything that I needed technically, but nobody was thinking about, okay, how is this person really doing emotionally? So after a month, I realized that it was not feasible for me to stay in the hospital forever. So it was like a crusade to self-advocate again for a different option. And when I did that, I also asked for support, for emotional support, because I was not doing well. And that was clear not only to me, but to my family. And I think that the fact that you need to self-advocate that much is emotionally draining and exhausting.
No
So
kidding.
it definitely doesn't help. And it doesn't help when you are surrounded by people that is not aware, because I am very sure that there's no provider that wants to damage their patients, right? It's just that they don't know. They haven't experienced something like that and maybe don't have the knowledge that it could be that bad.
Yeah. Yeah, absolutely. I can totally appreciate how this is not just one battle that you fought, right? You were fighting at each stage, at each month of pregnancy, each trimester, each admission to be taken seriously and to be, getting the care that you knew that you needed. Julia, I wonder for you, was there a moment when you found that you kind of broke through some of the barriers or some of the dismissals in the healthcare system? Or was this, like Maria, kind of a continuous cycle of self-advocacy?
For me, it was a continuous cycle of self-advocacy, even after my pregnancies. I think it's so important to note that going through postpartum after having HG is also a very different experience. Your body is recovering from a huge, physical toll. It may be prolonged malnutrition, prolonged dehydration, even prolonged isolation, not having the community or the people that you normally speak with. It's a very isolating time. So I think postpartum also, it looks very different after you've had HG. I've heard from many women in the HG community kind of coming out of it and then saying, what just happened to me? And looking back on it and realizing how severe and how bad it was. And that definitely happened to me after going through it, especially the second time. I was just so grateful to have my beautiful baby and my family together. And I was so grateful to be feeling well again. And I think it was just that realization, that moment, okay, what did I just go through? How is this okay? How is this possible? How can my body be sick or be vomiting hundreds of times, and then I just am supposed to recover as if I had a healthy pregnancy? I think that's huge, and it definitely, the HC has a toll on your physical health and your mental health as you recover as well.
Yeah, absolutely. Now, guys, we have a lot of, we know from our comments and our messages, a lot of nursing students, a lot of new nurses, a lot of medical providers who are at various stages of training. What would you like them to know? These people who are going to make up the bulk of our healthcare system in the years to come, what sort of lessons have you learned? What things were helpful from providers? What would you like providers to know about HG?
I think the most important thing is the more basic one, but really take the time to listen and validate what your patients are feeling, because nobody is gonna go and lie about vomiting hundreds of times a day. And if a patient is telling you that is that bad, it's probably because it's true.
Yeah.
Don't wait for your patient to lose 20 kilos, as it was my case, to realize, oh, yes, this is actually hyperemesis gravidarum. When you can do something beforehand and make a plan and put a plan in place for that person to at least have the minimum, I would say, well-being, quote unquote, because it's not that you're going to be great, but at least you have something.
Yeah, and that you have the support and the care plan in place for the months that are going to come in your pregnancy, right? We know pregnancy is 40 weeks for most people. So that's a long time to be experiencing vomiting 40, 50 times a day. That's, if anyone was experiencing that who wasn't pregnant, we would be investigating it very significantly,
we would
right?
be so concerned, right?
Exactly. But, because you're pregnant, like you guys said, and, you were constantly told, especially in the beginning, oh, it's just morning sickness, and being dismissed in that way. And, that's not morning sickness when you're that ill, right? So, yeah, I don't know. What about you, Julia? What would you like providers and nurses out there to know in the future so that they can care for patients like you in similar situations, hopefully better?
I definitely agree with Maria. I think number one, listening to the patient, really listening to them and what they're saying, and especially being compassionate, having empathy. If they're saying that they're so ill, I think compassion can really go a long way. Believe them when they say that they're not able to drink water, or things that may sound strange, like water smells odd, and the smell of it and the taste of it immediately makes me vomit. That is a very common theme when it comes to HG, and it sounds very strange, and it could be very easy to dismiss, but those little things, believing them and acting on them, I think is so important. I think the compassion can go a long way. I was so fortunate to have wonderful birth experiences with my babies and wonderful care teams at the time. I think that was very empowering for me, and I'm so thankful for that because my pregnancies were so difficult. And I think that was really key for me, the compassion from the healthcare professionals. And also, if there is something that seems off, extra check-ins can go a long way too. Waiting in between those set appointments that everyone kind of receives, it can be very long wait in between. So I think if there's a red flag, an extra checkup in between or a few extra check-ins to see where the patient is at can really go a long way.
That's such great advice. We go on in this episode to talk a lot about the importance of early recognition and diagnosis of hyperemesis gravidarum and of starting treatment pathways and strategies. How do you both feel, having kind of gone through this healthcare system and this uphill battle of management of your HD? How do you think that might have impacted your course?
Well, for me, in my case, when I finally got a plan, that was a game changer for me. So in my first pregnancy, I went to the emergency room for 3 months, almost each couple of days to get hydrated. And then after losing 20 kilos, I was begging the doctor, please, I need something else. Like, I can't be coming here day after day after day. And he finally referred me to a program that we have in the Calgary area. It's called the Community Paramedics. Instead of me going to the hospital, they came to my home. For my first pregnancy, we did it each couple of days. It was amazing for me because I was not dismissed anymore. I had something in place. I was miserable anyway, but at least I knew that some hope was coming, some kind of relief was coming, even though it was just for some hours. And then in my second pregnancy, after that long hospitalization that I described before, again, I was begging for another solution. Because unfortunately, the community paramedics couldn't take me for the whole pregnancy. So this time I got a referral to a home care program. It's called the Complex Care Hub. It is like a mix of physicians, internists, and community paramedics that come to your place and provide all the care there. And they did a very personalized plan for me. So they reviewed the algorithm. We kind of knew what it was going to work based on my first pregnancy. And then they made sure that everyone that come into my home knew which was the plan and was the right order of the medications. It was exhausting anyway because they spent with me 6 hours daily. I needed more care in my second pregnancy, unfortunately, but it made all the difference. I was bedridden. I was on sick leave from the beginning to the end of both of my pregnancies, unable to do basic things like walking, showering, dressing myself, but having a plan in place made all the difference, at least emotionally, because that impact of self-advocating really can take away your mental health away, while having a solution at least give you some sense of control of the situation, and also offering some small choices, because when you are in that situation, you lost control. Like, you are not controlling anything. You can do anything. You can do much. But then offering little choices like, oh, would you prefer this medication at the beginning or at the end? Would you like to receive your treatment in this chair or in your bed? Those small things give you some encouragement that you are still the owner of your life. And empowering the family is also very important. Even though my daughter was little, she was just 2 years and a half during my second pregnancy, the paramedics took the time to teach her what's going on, to get her familiarize herself with equipment. She even helped them to push some medications through the IV. And then they trained my husband to administer subcutaneous medication overnight, and hydration. So I think that was very empowering for us as a family, not only for me, because then I didn't feel that I was dismissed anymore, and I was taken care of 24/7, because when my uh, care team wasn't here, then my husband was trained to actually take care of me.
To help. Exactly. Which sounds like
Yeah.
similar to what Julia said as well, with being like having those check-ins between appointments, not going weeks and weeks before, you hear from your provider, having those people check in with you in your home, or over the phone, and listening to you is what seems to have made a big difference for both of you throughout your experience.
Julia, what about you? What do you think that would have meant to you in your pregnancy?
Yeah.
I absolutely think that a personalized plan would have been helpful. And I think it's something that, as Canadians, it's very difficult to see the just the lack of resources that exist currently when it comes to HG in Canada. So, there are women like me who are reaching out for support, who I was reaching out for support and not receiving what I was asking for. And I think it's very challenging because we don't know necessarily the path that we need to take when we're in that situation. So we have had people reach out to us saying, I go to the ER every 3 days to get IV fluid. Is there another option? My doctor doesn't know. I don't know what to do. It varies across the provinces and across the country whether someone can receive home care for HG, whether they're in the ER constantly, or whether they can go to another place just to receive something like IVs and fluids. So I think the care is so different across the country. I would love to see it being more standardized, and for there to be a standardized test for HG being used in Canada so that it can be identified quickly instead of waiting, till 12 weeks and seeing if it starts getting better and having a practitioner say, okay, it'll be better 3 weeks from now. Okay, it's not better. Maybe it will be better another 3 weeks from now. So just wait. And waiting is not a solution, and waiting is not care.
Absolutely. Now, as we wrap up, guys, I would love to hear more about the resources that we do have available, either locally or online, for our patients who may be listening, or family members and friends, people who have the opportunity to support somebody with hyperemesis gravidarum. Where would you suggest what resources have you found that are helpful and are available to patients experiencing this?
Well, we have our community Facebook group. There is a group for survivors as well, and for patients who are going through HG. It's called HG Canada. And there you can receive some tips, at least some encouragement, or just vent a bit about what you are going through. And then Julia and I are always happy to support finding local resources. So we have experienced already this. We know some resources in our own areas, but we are doing the work to find resources no matter the province, and try to connect people with those resources so they get what they need.
Amazing. Well, listen, it doesn't excuse the lack of resources that we have within the healthcare system as a whole, but thank you to both of you for providing that person-to-person connection and that individualized, approach with the people in your Facebook group and the people who reach out to you through HG Canada. I expect that, even in situations where resources may be scarce, in the face of the isolation that this disorder and this disease causes people, then having that community, having that sense of belonging to people who understand what you're going through, I can only imagine is indescribably valuable.
Yeah, just having someone to talk to be able to be like, I'm not crazy, right?
Yeah.
To just have those conversations is probably so impactful. But I wanted to thank both of you for your advocacy work, because I know that this probably takes a lot of time out of your days
Mhm.
and time that you want to be spending with your families as well. And I know for a fact you are helping millions of women out there. Well, millions, maybe not millions, but lots and lots of women out there. Hopefully millions.
Listen, one patient at a time, right? One
One
pregnant
person
person at a time. Um,
Exactly.
and guys, we will link all of the resources that Maria and Julia have sent to us in the bio of this episode and on our RSS. So if you are suffering from HG, or you're not sure if you may have it, or again, if you know someone, if you want to become a better support person, whether that's through the healthcare system or outside of it, please look up these resources and learn more about this disorder. Julia and Maria, thank you again so much for joining us. Before we log off, do you have any last messages for our listeners? Anything that you want to impart?
Sure. I just want to touch on the amazing resources that are available. There is the Healthy Pregnancy Hub, a resource that's Canadian. And so if you're looking into medication options, that is a wonderful resource for Canadians. And the HER Foundation is based in the States, but they do support internationally, and they have some really great support groups that you can join, some really great information for you if you're going through HG, also information for families and friends. So it is a really wonderful resource. We do have an initiative coming up in August of 2026 where we're going to be hosting an HG art exhibition. So that's something that more information will come out about in the new year, but it's hopefully an exciting initiative where the HG community in Canada can come together in different ways and address that this is going on, and have the community kind of come together in a sense in one specific location. I would like to thank you so much for having us on the podcast today. It's such an honor, and I've really been enjoying your podcast episodes. We're so thankful that we have this episode with you about Hyperemesis Gravidarum, and we hope that someone maybe who is questioning whether they have it or not can get a little bit of information. So thank you so much for having us on the podcast today, and we're so grateful and thankful that you hosted us.
Well, thank you so much, Maria and Julia. We are so happy you were on and able to share your experiences with us on the Push podcast. Hearing the lived experience truly changes how we can understand this diagnosis, right? So we really appreciate having you on the Push podcast. And we're going to continue to talk about what hyperemesis gravidarum actually is from a diagnostic perspective. So Meghan, why don't you, deep dive into the pathophysiology of it, because I personally find this very interesting, this is, go ahead.
So I think that is a great segue. And it's honestly something that I find is one of the first questions that my patients with HG ask is why did this happen to me? Right?
Yeah.
And how is it possible that so many of my friends and family members and people that I know seem to float through this part of pregnancy without any difficulty while I'm sitting here in the emergency department or the hospital. And I have to say as well, although I did not experience hyperemesis gravidarum, I did experience quite significant nausea and vomiting of pregnancy. So I never had electrolyte abnormalities. I was able to function in my day-to-day life, but I remember feeling honestly so betrayed in some ways that I didn't appreciate how bad it can be and how much it just impacts every part of your life. And I remember when I had friends who got pregnant sort of after me, almost preparing them in advance and then feeling so happy for them, but also so sad for myself when people didn't experience the nausea and the vomiting as bad as I did.
Yeah.
Right. It was a little bit of a lonely experience.
Absolutely.
Feeling
again, like everyone else did so much better than you.
Yes. Especially when pregnancy is something that so many of your friends and family experience.
Yeah.
But there's such a wide variety of how people experience it. Like someone's pregnancy can be completely great and literally they have no symptoms and they're functioning properly and they can do everything they want. And then there's you who's waking up every day and throwing up, right?
Yeah.
That's a huge spectrum, right?
Yeah, absolutely. But there are some good reasons why this is something that impacts people really differently in their pregnancies and differently even sometimes from one pregnancy to the next. So we don't necessarily have a single cause that we've identified that clearly causes hyperemesis gravidarum. And that's because it's likely multifactorial, right? So likely several different things kind of compound to create this picture of HG. There are a few strong theories, though, that have emerged over the last few years that have allowed us to understand a little bit more who might be at risk and why. So the first thing would be hormonal factors. And this is mostly the link with beta HCG, which is one of the main pregnancy hormones. We do know that there is consistent associations between high levels of HCG and hyperemesis gravidarum. And we know this because of, as well, pregnancies in which HCG is at a bit of a higher level than baseline in general, right? So that's things like multiple pregnancies, right? Or things like molar pregnancies.
Yes.
And we also know this as well because HCG actually peaks and then plateaus and drops a bit, peaking in first trimester and then plateauing afterwards. And that is exactly when hyperemesis gravidarum as well as nausea and vomiting of pregnancy tend to be at their worst. However, again, high HCG alone doesn't explain everything. And some patients with high HCG have no symptoms, which is likely different due to not just like individual, differences, but also because there are different, what we call isoforms or kind of like versions of HCG. And also people have different receptor sensitivity. So I think we've talked about this in some of our previous episodes as well, and some of our episodes on like PCOS, right? But many hormonal factors or many hormonal issues are not just due to like levels of the hormone themselves, right? But those hormones kind of fit into a receptor on different tissues, almost like a lock and key. And how sensitive that lock is to the key, or how able it is to receive any key, right? That looks kind of like that, really can impact how much effect someone feels from that. And so that's one of, again, one of the reasons why we think that some people respond a little bit more strongly to an high HCG level versus others.
Right. Yeah.
I will say as well, I feel like this was maybe part of why I had such bad nausea and vomiting in my first stage of my pregnancy. My HCG was so high at one of my first checks. One of my friends and OBGYNs, I remember she checked it for me while we were operating that day. Because I was really starting to feel not great. But it hadn't really set in yet.
Okay.
And I remember she pulled up my lab results on the computer and I wasn't facing the screen. And she just looked at me and she said, "Do you have a history of twins in your family?"
And you're freaking out.
And I was like, oh my God. Yeah, freaking out. And then she was like, "Are you feeling okay?" And sure enough, shortly after that, I started feeling not so great.
And I see that online too with like pregnancy announcements and people who are like documenting their pregnancy, like YouTubers and stuff. They're like, "I've been really sick this pregnancy." And then they're worried for that first scan because they're like, maybe it's going to be twins.
Listen, twins are wonderful. Twins are a gift. We love twins in labor and delivery.
Oh yeah. They're so cute.
But as the person that was about to house that pregnancy, that was an undertaking I was not entirely prepared for in that moment. I did not have twins. I just had a singleton. But
on that note, guys, let us know, like message us, comment, DM us. If you would be interested in an episode on multiples. So twins, triplets, all that kind of stuff, because I think that would be kind of a fun episode to film as well. So
I think that's a great
let
episode.
us know.
So moving along, there is a secondary, excuse me, sorry. Kind of a secondary cause of HG that we have begun to experience or begin to understand in a little bit more detail lately. And that's the genetic regulation associated with things like appetite and nausea. And so there are a couple of genes that have been identified, GDF15 and IGFBP7. For what it's worth.
She's just going to say the whole alphabet here.
That are providing some biological explanation for why people may be experiencing HG. So both of these are expressed in the placenta, and they affect things like appetite, weight regulation, as well as the brain's vomiting center. So higher maternal levels of these genes are strongly correlated with more severe nausea and vomiting. And this mirrors actually as well what we see in cancer studies, is that people who express GDF15 at higher levels may lose more weight and have poorer appetite and more nausea and vomiting associated with cancer treatments. And so there may, again, be kind of like a predetermined factor as to whether or not we might be impacted more or less by pregnancy in general, but also by even those hormonal aspects we talked about earlier. And then the last couple things are, number one, pregnancy slows your GI motility, right?
That's that pregnancy constipation that
exactly,
I'm sure some people have experienced as well.
So your digestion, your gastric emptying slows over with the pregnancy itself. And that can impact how you feel with respect to like nausea and vomiting 100%. As well, and can compound on the issue of HG. There have been some studies that have shown that HG patients have delayed or dysrhythmic gastric emptying. So it's not happening at quite the right patterns that we would want it to happen. Although those results are a little bit inconsistent. So kind of like a space to watch with respect to how we understand HG and its impact on individual people. And then the last thing is something called H. pylori, which is a gastric bacteria that is common enough and can cause things like dyspepsia or like acid reflux, burping, that kind of thing at baseline in people who are not pregnant. But a present H. pylori infection actually increases the odds of experiencing HG by threefold. So 3 times higher in patients who have an H. pylori infection. However, again, not all HG patients have it, and not all patients with H. pylori develop HG. And so just a multi-layered disease in general, right? That can have multiple different contributing factors. And truthfully, for any one individual who's experiencing HG, probably a combination of these factors is weighing in on how their experience is actually carried out.
Now, okay, I have a question that is not in our outline.
Oh no, Sydney always does this to me.
I love to put her on the spot, guys, because I feel like it's fun. This one I think is probably, this could be a whole other episode that I would love to dive into with you.
Sydney's just out here today brainstorming new episodes.
I am. I was like, we need to do this, we need to do that. But anyways, okay, this one I actually shout out to my sister because she's the one who told me that we need to do an episode on this, but I feel like it kind of relates to this. There's been a lot on social media nowadays about the male sperm, like the sperm that's used. So whether that's from your partner or if it's IVF or whatever, and how that is responsible for if you experience more or less nausea and vomiting during your pregnancy.
I actually don't know off the top of my head how linked that is or not.
I figured you wouldn't, but I wanted to put it out there because there's a lot of talk about that right now. I found it interesting because I mean, who actually knows if that's related or not?
I'll look it up once we're offline. And I'll stitch a clip. If we find something that links the. Listen, we love to blame the dads.
That's what I was just going to say. I feel like sometimes it's like maybe it's just easier to blame the sperm. But I thought that was funny. So I was curious if you knew anything off the top of your head.
Not off the top of my head, but let me go back to up to date. Let me check it out.
Totally fair.
Okay. So listen, how do we even diagnose hyperemesis gravidarum? So as we mentioned, it represents kind of the severe end of the nausea and vomiting of pregnancy spectrum. I mean, because of that, there's no single universal diagnostic criterion, right? But clinicians often agree on several key features that we see frequently with patients who are experiencing hyperemesis gravidarum. So really it's defined by or characterized by, as we've discussed, persistent vomiting, right? An inability to maintain adequate oral intake. So that means you can't keep down fluids. You can't keep down solids at all. weight loss more than 5% of pre-pregnancy weight is often quoted as one of the kind of metrics of HG.
Yeah.
Dehydration and signs of dehydration, right? In someone's urine tests and their lab tests. Symptoms that are severe enough to impair daily functioning. And usually, again, onset early in pregnancy. So less than 16 weeks of gestational age. And there are a few different, again, like diagnostic criteria, pathways that include some or most of those elements.
Yeah.
But interestingly as well, there is a new definition called the Windsor definition or Windsor criteria that's established from an international consensus basis.
Okay.
And basically it states that to diagnose HG, all of these things must be present. So again, symptoms start early in pregnancy, not to discount nausea that pops up later, but I think that should red flag for physicians that we should not just be blaming nausea and vomiting of pregnancy if someone starts to experience severe nausea and vomiting at a later stage in their pregnancy.
Yeah.
The nausea and vomiting is severe. The patient can't eat or drink normally. And then key here again is daily activities are limited.
Yeah.
And now what I'd like to point out about this definition and what I like about this definition is that it focuses less on like number metrics and it focuses more on the impact of HG on a person.
Yeah.
Right?
Yeah.
As opposed to saying, oh, well, you've only lost 2% of your weight or you haven't lost weight. You cannot have HG in that context, right? This characterizes and shapes the disease more around the experience of the person who is going through it. And I think that that's like a very valuable clinical tool in and of itself.
Absolutely. Yeah. So now that we've talked about what the actual diagnostic criteria is, I know a lot of you listening are probably wondering, do I have it? When should I seek care? When should I
make the decision to come to the hospital?
Exactly, right? Because again, a lot of people feel like they're overreacting, but myself as a labor and delivery nurse, this is when I get a lot of triage calls. Yeah. A lot of people calling saying, listen, I'm feeling awful. Here's what's happening. Should I come in? Should I stay home? And so these are the things when I triage over the phone, these are the conversations we're having, but I want to know, are you peeing? Because that's the main thing. If you're not peeing, it means you're dehydrated, right? Yeah. Are you keeping any liquids down at all, right? Or are you completely just unable to keep anything down? And again, I do get these calls for people who might have a stomach bug or food poisoning too. Like if this is not early in pregnancy and they're thinking, it's not morning, quote unquote, morning sickness or HG. So if you're not able to keep anything down, if you are feeling very dizzy, lightheaded, if you are actually having episodes of syncope or fainting episodes, if you're, missing work for days and days, weeks on end because you are unable to function. Another thing I like to ask my patients is if when they stand up, if that's when they get that head rush that you feel, that dizziness sensation, because that's usually the orthostatic hypotension where your blood pressure is actually dropping.
Another marker of dehydration.
Exactly. Yeah. So it's mainly those severe dehydration things that we are looking for. And of course, if you're saying yes to these questions over the phone, I always recommend come get assessed in triage, because usually we need to give you IV fluid replacement therapy. And we can also give you medications through the IV because obviously you're unable to take any medications by mouth, but we can give it to you through the IV to hopefully be able to settle your tummy and be able to get some fluids into you. Yeah.
Now, some of the really worrisome features associated with hyperemesis gravidarum, Sydney's talked about a lot of the like early signs, the things that are more indicative of dehydration. Yeah. And I'll pile in as well to say that I think that an inability to keep down fluids in particular would be a reason that I would tell one of my patients to go into triage, at least to be assessed to run the blood work, to assess for severity, because even if you are not dehydrated in that moment, you are likely to become dehydrated. Exactly. You are certain to become dehydrated, right? Yeah. If you can't keep down any kind of fluids at all.
Exactly.
But in very severe versions of this, and this is quite a rare complication of hyperemesis gravidarum, but part of why I think it's really important that people take it seriously, right?
Yes.
Is something called Wernicke's encephalopathy. Have you heard of this, Sid?
I feel like I it sounds familiar, but I can't put my finger on what it is.
It's a classic, I think, exam question, right?
Yeah,
For people who are not receiving adequate food intake, right? So this is, again, a rare complication, but certainly a risk of untreated hyperemesis. Yeah. And it happens when your body becomes severely low on thiamine or vitamin B1.
Yes.
So usually we get our thiamine from food.
Yeah.
But if you haven't been able to keep anything down for a long time, your levels of thiamine start to drop. And thiamine is essential for brain function.
Yeah.
So what this can look like for people when you run out of it is that your brain can't work properly. We start to see symptoms like confusion, trouble walking, or strange eye movements, so nystagmus, where you get kind of beats side to side of the eyes.
You're bringing me back to nursing school.
I was going to say, this is like a classic, this feels like a med school,
but things
Royal College
I personally have
nursing
never
exam.
seen in practice. So I don't know.
I have never seen it in practice in our metropolitan city. And I would hope that is because, number one, it is rare, but I also hope it's because we have resources to manage people, I think, effectively with hyperemesis.
Yeah.
But certainly, again, I think that the benefit of like mentioning these like rare complications is not just that, like, obviously we want people to be aware that they can occur, right? But I think it should also serve as like a warning to anybody that thinks someone should just tough it out, right?
Yeah.
Number one, I don't think that we should need to have a like horrific complication that can occur in order to like impress upon people the importance of treating someone's nausea and vomiting in pregnancy, right? The fact that you're going through hell should be enough of a reason to be treated.
Yes.
But as if we needed like one more thing, right?
I know.
There can be severe complications from not being able to have proper intake of food, right? Or intake of fluids.
Yes.
Like these things can be quite severe
Dangerous.
medically and dangerous to people. And so again, like I'm very happy to treat people as our, I think the vast majority of my colleagues, just based on the fact that like it is extremely shitty to experience this.
Absolutely.
But there are severe complications as well that can be associated with untreated hyperemesis.
Yeah. And, that's why I'm also happy we're having this conversation is because I do think in the past, there have been women who have experienced HG and maybe not been given the time of day like they should have been because they've been, quote unquote, complaining or, which is completely not true at all. This is just, unfortunately, women's healthcare in the past has not been where it should be. And that's why we have these conversations on the Push podcast so that you guys can advocate for yourselves better because these things are not normal. And we do not want you getting to a point where you are experiencing a severe complication from this disease.
Well, and as we move into talking about like what actually works to treat hyperemesis, I think something that's important to call out as well, and this is something that I hope like my colleagues in primary care potentially who often see patients before we start to see them in an obstetrical clinic or nurse practitioners, right? This is what I kind of want to jog in your brain for hyperemesis gravidarum is that getting ahead of it can prevent worsened hyperemesis, both in the short term and in the long term if we consider the course of the disorder itself.
Yes.
So we want to be treating you. We have to take nausea and vomiting of pregnancy seriously, even when it's starting and just rumbling, right? We want to make sure that patients have the tools to be able to treat themselves well, because if this is to become hyperemesis, early treatment and therapy and continued monitoring and follow-up is essential to like preventing and trying to like mitigate the impact of this disease in the long run. So the good news is we do have some treatments that can work for people, right? And I will say, like, I'm sure that there are lots of patients who have tried everything and are, having to move to like pretty significant interventions in order to stay okay during their pregnancy.
Yeah.
But there is good evidence for a lot of this. And I'm hopeful that like the more and more patients we treat appropriately for hyperemesis, the more those cases of like very severe refractory hyperemesis become like the rarity, become the exception as opposed to the rule, right?
And, that's what we're going to get into talking about meds and everything. But I just want to preface this by saying, please, guys, do not feel guilty for needing medication during pregnancy. A lot, so many patients that I've talked to, they are always worried, which rightfully so. Like, I mean, it's good to check to make sure the medications you're taking are safe during pregnancy. But if you need these medications to literally survive your pregnancy, it is okay. Do not feel guilty. Do not beat yourself up like you are, the bad guy for needing these things to get through your daily life.
No.
Trust me, you're like, we would not be prescribing these medications if it wasn't safe and if it wasn't in your best interest. So keep that in mind.
Absolutely. So first and foremost, a like tiered treatment approach is what has the best evidence for it. So we start kind of at like lower level oral medications. We can move up through higher order oral medications. And then some people end up actually requiring IV medications or IV fluids, either consistently through the period of their pregnancy, in which HG is the worst, or intermittently, right? To come in, kind of get on top of the HG, like titrate back down to oral medications and then be able to go home on that. So starting at the first year, and I'll say as well, like I have found, at least in my residency, I was very fortunate to work on a unit in particular that had a really like structured but tailored approach to hyperemesis, and that really changed the way that I saw the treatment pathway. And so these are kind of some of the things that we can do. But really, like your treatment for HG should be tailored to the symptoms that you're experiencing, the place in your life that you're at, and the resources that you have available in your community and at home.
Absolutely.
So tier 1 for hyperemesis starts with things like vitamin B6 or pyroxidine, or a medication that combines doxylamine and B6, which in Canada is called diclectin. And so that's our first line medication for nausea, mostly because it's the best studied. It has the best safety data associated with it. Now, there is some evidence for ginger associated with nausea and vomiting in pregnancy, but I will say that the best evidence for ginger is for lesser nausea and vomiting in pregnancy, so less severe
Morning
forms.
sickness versus
HG. Versus HG. It's not as well studied in HG. Now, I don't think that it's harmful in that context, but certainly an HG patient should not be feeling like they shouldn't be on like more intense medications than just ginger, because really, again, like the evidence for benefit with ginger is in nausea and vomiting that is not impacting one's ability to function through their daily life quite as much as HG. Similarly, acupressure bands have some mixed evidence for them. There are some studies that have shown that they do decrease the severity of the experienced nausea for some people. There are others that have shown that they are less effective or not as effective as placebo, but certainly, again, not likely to hurt. And the studies that have found some benefit are in nausea and vomiting of pregnancy, not hyperemesis.
Okay. Did you try any of these with your pregnancy?
I was on all the oral medications. So that's why I say, like, I realize now I had like quite severe nausea and vomiting of pregnancy, but I was not dehydrated. I was always able to keep down fluids. I was intermittently not able to eat, but able to like keep my nutritional status enough that I like didn't have to go into the hospital. Although I have to say there was actually like week 9 was my worst week. And there was a moment where I started to wonder, am I going to have to be admitted to my own hospital? Because I couldn't eat anything. I couldn't keep down any food at all.
No matter what you did.
No. And I was on like a steady regimen of all the medications that we'll describe that were taken orally. I'm
curious about the ginger gravel.
The ginger gravel.
Touched you.
A ginger gravel worked at the beginning. And it worked at the end. I stayed on it.
In the US, I don't think they have gravel, but that's what's it called in the US? Oh gosh, what's it called?
It's dimenhydrinate. Diphenhydramine is Benadryl, but I'm not sure what the
Dramamine. That's
Dramamine?
it.
Is that what it's called in the US?
Anyways, I digress.
That does take us into our tier 2 antiemetics, right? Or anti-nausea medications. So there's good evidence for medications like antihistamines. So that includes things like Gravol, although obviously one of the side effects of Gravol is drowsiness. Dopamine antagonists, so things like metoclopramide, prochlorperazine, and promethazine. And then ondansetron is also a very highly effective medication for nausea. There was previously some debate with ondansetron where earlier studies found that ondansetron potentially had an increased or carried an increased risk in first trimester of causing cleft lip and palate, as well as cardiac defects. Now, there have subsequently been several very large systematic reviews that have combined data from all these different studies that have no longer shown that effect. The weakest evidence that persists a little bit is perhaps a very, very, very slightly increased risk of things like cleft lip and palate. But again, the broad sense in these like huge bodies of data is that Zofran or ondansetron is a safe medication to take, even in first trimester if you're experiencing nausea. Although if we're again, and in the context of hyperemesis, I have to say, like, I worry far more about the impact of hyperemesis on someone's pregnancy and on their mental health and well-being.
Absolutely.
As well as their physical health than I do about
an extremely remote chance of any kind of issue with something like ondansetron.
Oh, I love Zofran.
But
It's
if you're
the best.
same, and I
works so well.
I took it in my own pregnancy and first trimester because I wouldn't have functioned without it.
Yeah.
But usually that's how I explain things to my own patients who are experiencing like nausea and vomiting of pregnancy.
Yeah.
And I'll say like if people are well managed on other medications, then that's totally fine.
Yeah.
And it would be like extremely cautious, but like not unreasonable to like hold off on a Zofran until second trimester if you really wanted to play things like the most safe.
Yeah.
But I really don't feel that anyone, based on the data, the evidence, it is a very well-backed medication to use for nausea and vomiting of pregnancy. And it is very much in keeping with best practice for hyperemesis gravidarum, regardless of trimester.
Yeah. It's very effective. It really is. I give it to my patients in labor a lot too.
Yeah.
When you get that labor nausea too.
Yeah, exactly. Now, for more severe and refractory cases, we do use things like IV fluids, right? So some people need to have IV fluids either in hospital, right, to replenish their IV, and including electrolyte replenishment.
Yes.
Some people even require IVs to be maintained and inserted at home, right, through home care nursing.
Yeah.
Some people require thiamine supplementation.
Yeah.
If they are, and this is always given before dextrose or sugar.
Yeah.
And that is in the case of, again, like really severe refractory disease.
Yes.
Some people require steroids actually.
Yeah.
To help kind of calm things down.
Yeah. Yeah.
And as well as, in very severe cases, people require either enteral feeding or tube feeding or sometimes TPN.
Yeah.
Or nutrition that's coming in kind of through an IV line.
Through an IV, yeah.
Now, again, these are like rare circumstances, but have I seen them used to keep people okay during a pregnancy? Yeah, I actually have.
Same.
I actually have.
Yeah.
And as I mentioned, depending, like I would hate to come on here and say like, this is who needs what, because truly I do think it should be like tailored more to the individual circumstance than something like that. But these are the tools that we have at our disposal.
Yeah.
And even amongst these higher order medications and like things like IV nutrition, IV supplementation, there's definitely a role. There are people who require stints with us in hospital to do all of these things and then are able to go home on oral medications.
Absolutely.
And then there are patients who unfortunately require, like their HG just dictates that they require
their entire pregnancy.
Continue IV supplementation.
Like they end up with a PIC line, which is just more of like a permanent IV line.
Not
that they
permanent,
go home.
permanent. That stays forever. It just doesn't need to be changed every few days like a regular IV.
Exactly. Which some of you who may be listening have had that. But that way you can have home care as well. But these are, again, very severe forms that we don't see often, but it does happen. So
Now, Sid, for somebody who is maybe just starting to experience nausea and vomiting of pregnancy, we're not yet sure whether this is going to be HG or whether this is going to fall kind of a little earlier on the spectrum.
Yeah.
What sorts of advice would you give somebody with respect to the non-pharmacologic things that we can do to help manage nausea and vomiting during pregnancy?
Yeah. So one of the first things I usually say is don't stress if that first trimester or those first few weeks you are unable to eat anything but like French fries.
Yep.
If French fries is what's getting you by and that's what you can stomach and tolerate, that's okay.
Yeah.
Like, do not stress about your diet and making sure you're getting all of the nutrient-rich foods and all that kind of stuff, because sometimes those first couple weeks you're just in survival mode and you can have only saltine crackers or French fries or like little things like that. Like sometimes people will have their food that they know is safe and that works for them, and just eat as much as you can of it. It's okay.
Something I think that people need to be, that we should talk about more, that is like essential, I think, to understand nutrition and pregnancy in general.
Yeah.
I hear so many people like feel so much guilt about eating whatever like keeps them sane in the early stages because they worry about the nutrition for their baby.
Yes.
Right?
Exactly.
But the truth is that the placenta, which connects your circulation to baby's circulation, only really kicks into gear towards the end of first trimester.
Yeah.
So at the time that HG or like nausea and vomiting of pregnancy is at its worst, baby's actually not really seeing anything that you're eating anyway.
No. So
it does not matter. It does not matter.
Need to worry.
But small, frequent, carb-heavy meals are some of the best things. Bland carbs are some of the best things that you can eat
with respect to like quelling nausea and vomiting.
Yeah, think about like if you have the stomach bug, like you're gonna want carbs. And something I always tell patients who are dealing with this is to have a little bit, like have something beside your bed before you actually even get out of bed. Nibble on it. So whether that's a cracker or something like that, a little cookie or something, eat that. Sometimes that will settle your stomach enough because when your stomach's empty, that tends to be when the nausea gets worse. Again, this is not for everyone, but for majority of people.
Yeah.
And making sure you're having your electrolytes. So sometimes I tell people to literally just suck on popsicles too. That gives you some sugar if you can keep that down. You can make your own electrolyte popsicles if you want at home with like Gatorade or something like that. Or add that into your water like a liquid IV, stuff like that. They do help. They have the electrolytes. And if you can keep that down, go for it. That's what we need.
And the same thing applies for oral hydration too, right? As for meals. Small, frequent sips, right?
Yeah.
A lot of people find that to take like a big glass of water just really upsets their stomach and they're not able to keep that down. Keep a water bottle with you all day.
Yeah.
Take small, frequent sips, one sip at a time, right?
Yep.
And that oftentimes is enough to maintain someone's hydration status.
Yeah.
Without kind of like triggering the vomiting reflex.
Exactly. And I obviously have not had a baby myself yet, but I have dealt with motility issues in my past. And that was one of the hardest things for me was drinking an entire glass of water. It was nearly impossible. So small sips all day long. Different temperatures can help too. So colder fluids or warm fluids I find can be helpful. So some people tolerate tea more than other people, or just ice cold water. Sucking on ice cubes too. That's actually okay to do as well. I found that helpful for me when I was dealing with that. So yeah, there's all kinds of stuff, all kinds of little tricks out there that you can try.
Yeah. Now, we've talked a lot, I think, about some of the impacts of hyperemesis with respect to like physical health, right? But what we've only touched on so far is the impact on mental health, right?
Which is huge.
And it is gigantic. It is gigantic. Hyperemesis gravidarum is strongly associated with anxiety, with depression, and in severe cases with suicidal ideation.
Yeah.
That's how severe this can be for patients.
Yes.
Severe vomiting can significantly impact your ability to function, as well as your family life and your employment at some times, right? Because oftentimes employers don't understand either, right? Like what somebody is going through or why they're not able to show up in the way they were previously.
Right? Like I can't imagine someone going through 9 months of the stomach flu. It's insane to me that some people are able to get through that. It's just, I could, no wonder people are having trouble with their mental health dealing with that every single day. It's so isolating.
Yeah.
You'd be scared to leave the house because you might vomit, right?
Yeah.
I know people who have like kept barf bags in their purse, in their car, you know, it's, kudos to you guys for having gone through that because it is very difficult.
And some people, most hyperemesis and most nausea and vomiting of pregnancy resolves by the end of first trimester or early second trimester.
Yeah.
But there are a small number of people that continue to experience nausea and vomiting through second trimester and sometimes even through the entire pregnancy.
Yeah.
And that is incredibly isolating to experience.
Yeah. And I said 9 months, but even 3 months, 1 month of this is enough to.
Well, this is the thing. I really didn't appreciate before I experienced nausea and vomiting of pregnancy myself, how long first trimester is. Oh, I was sick probably from about like 6.5 weeks to like, I think it was around 15 weeks by the time it was like truly done. And I like felt normal again with like the peak being like the 9 to 10 week kind of area. And I remember just like being so overcome by how many days that is to feel awful all day long and to just be like trying to like function at even your like lowest setting,
survival mode.
Exactly, your like lowest setting just to get through your day. And again, my nausea and vomiting did not even extend to the point. Like I actually felt like I was able to function like well at work. I wasn't able to do anything else. Like all of my energy went into being like okay at work, and then I was non-functional in every other part of my life.
Yeah,
but again, like it just struck me how long that is. It is so many days to be sick. It is so many hours to feel awful.
Yeah.
And I truly like my patients have, and anyone who's experienced this just have my deepest empathy because the isolation of that cannot be understated, right? To be so sick and then to have people just say to you, well, it's just pregnancy, right?
Yeah.
Like,
well, you're
oh
pregnant.
yeah, first
What did you
trimester
expect?
sucks. You're pregnant. What did you expect? Everyone feels shitty in first trimester.
Yeah.
And it's very, it can be debilitating.
Yeah.
And the scary thing too, I think, for a lot of people who experience this is that recurrence is pretty high, right? Depending on the study that you look at, recurrence can be as high as 80% in subsequent pregnancies, right? And there is a strong familial pattern. And again, I think that speaks to some of the genetic links that we've talked about previously.
Yes.
So not to like kind of wrap up or start to wrap up on such a low note, but I think the heartening thing about that too is that knowledge and information is power, and we can shift the course of hyperemesis, right? We may not be able to always prevent it entirely, but we can impact someone's experience with it with conscientious, comprehensive, empathetic care, right? And by instituting these interventions early and consistently and making sure that our patients and our loved ones have good follow-up during that time, right?
Exactly.
Yeah.
And if you did experience it with, a pregnancy that you did have, and then you're extremely scared to try again for another pregnancy, even though you want to grow your family, talking to your providers ahead of time, maybe setting up and making sure you have mental health support in place.
Hyperemesis gravidarum is a like documented source of trauma and PTSD, again, because it is I can't understate the impact of that experience on someone and again, the isolation of that.
Absolutely.
Right?
Yeah.
We also have a variety of different resources to share with you today. And again, we have to thank HG Canada for
thank you so
helping us craft this episode today and for providing a lot of not just the resources to us to share with all of you, but for being true advocates in this community and for setting up so many of these resources themselves.
Yeah, and feeling comfortable to share your stories.
Yeah.
It's hard to do sometimes, right? To talk about when you've been your most vulnerable.
Yeah.
But I know it's helping people out there. So we do really appreciate it.
So if you are suffering from severe or any form of nausea and vomiting of pregnancy, anywhere along that spectrum, you are not alone. You are not weak. You're sick, right? And like this is a process that's happening to you, not something that you are driving or that you are just unable to cope with.
Yes.
But again, you're not alone.
You are
right?
not alone.
A lot of women experience this. A lot of pregnant people experience this.
Yeah.
And early treatment and support resources can really make all of the difference as we begin to navigate how to deal with this disease. So we're going to link our resources here in the bio of this episode in all of our posts around Hyperemesis gravidarum. Please reach out. Join the Facebook support group if you're here in Canada.
Yes.
Meet other people who are experiencing this
Sometimes
as well.
that can be really helpful, right? To find your community and to lean on them because people might have experiences and tips and tricks that you haven't even thought about.
Yeah.
And sometimes it just helps to talk to someone who's gone through the same thing,
Yeah.
right?
And talk to us. Let us know in the comments what your experience has been, what helped you, what didn't.
We want to know.
Exactly. And how we can help to serve as better providers and better advocates for people who are experiencing this.
Yeah.
And one last thing again, before we wrap up today, I want to thank again, I know we've called out HG Canada as an organization, but I really want to thank Julia and Maria again for not only joining with us and sharing their stories and being vulnerable and open and courageous with that, but also for creating the resources they have and the platform they have for other people to feel not so alone as they go through this.
Exactly. Yeah. Well, thank you so much, everyone, for listening. If you haven't followed us on Instagram and TikTok, you can find us at the.push.podcast. And we release a new episode every Wednesday. So make sure you check us out on Spotify, on YouTube. You can watch us on YouTube too, and on Apple Podcasts. So thank you, everyone.
Bye.
See you next time.